Okay, so I'm doing case study number 3, which is cancer genetics, a family in need. Uh, so in this case study, the nurse starts a new job on the oncology unit. She is working with Dr. Aiken, who has a specialty in cancer genomics. A 22-year-old male named Lee came in recently due to a tumor-like growth on his adrenal gland, and a biopsy is being performed. Lee's mother, Grace, was recently diagnosed with bilateral breast cancer. Lee has a family history of cancer besides his mother, such as the mother's brother died from leukemia, the mother's father died from soft tissue sarcoma, and the mother's grandmother died of a brain tumor. The nurse believes that there is a chance of inherited genetic defect due to the various types of cancer presented in 4 different generations, such as the sarcoma, brain, breast, leukemia, and now adrenal. There are seven genetic disorders in relation to adrenal cancer that could cause other cancers. After the discovery, the nurse talks to the doctor about her thoughts on Lee having an autosomal dominant adrenal cancer, who agrees and wonders about Lee's siblings. If Lee has one of these genetic defects, they would be inherited from Grace and would predispose Lee to various types of cancer. The nurse worries about telling Grace due to her low spirits from breast cancer and does not want to make her even more upset. She also worries about Lee because he is so upbeat and does not want to bring down his optimistic and happy personality. Due to research from the nurse after her suspicions of a genetic defect that predisposes Lee to cancer, she was able to find ways to prevent and treat the disorder, which include frequent checkups and avoiding risk factors. It is also important to ensure the siblings are getting tested. After the biopsy of Lee's tumor-like growth on his adrenal gland, it was found to be adrenocortical carcinoma. Dr. Aiken, who is in charge of this case, is an expert of this area as she is on the verge of developing treatment for this cancer by figuring out the different genes involved with adrenal cancer. Dr. Aiken uses microarrays as a way to categorize the cancer genes, which allows detection of the most common genes in adrenocortical carcinoma. This will allow for gene expression to be analyzed and compared to normal tissue. As Dr. Aiken collects DNA samples from Lee, she appropriately gets the consent form from Lee, checks hospital policies, and Lee's insurance company to ensure that he's able to get genetic testing. From this, it showed that Lee had a low expression of the TP53 gene, which is common in ACC. Due to its germline mutation, it is highly likely it will be passed down to his offspring, which Lee had explained he wants in the future. The nurse eventually becomes attached emotionally to Lee and his family. As the research for treatment continues, the nurse discovers gene therapy trials for TP53 gene. However, the FDA has not approved the treatment associated with the trial, which stopped the trial overall due to lack of evidence that the treatment was effective. The nurse tells Lee and his family about the trial anyways, without discussing the FDA not approving it. To her enjoyment, Lee and his family have hopes that this therapy will cure his disorder. After the nurse discussed this all with the family, the doctor comes in to talk with them. Dr. Aiken finds out that the nurse has been discussing treatment options with the patient and his family without talking to her first. Dr. Aiken sets up a follow-up appointment as well as appointment for genetic counseling for Lee. She also sets up an appointment for Grace to see if she is a 53 mutation carrier. She is allowed to get genetic testing, and it is her decision, and recommends the siblings who are both under the age of 18 should also get tested if they have the TP53 mutation to then be able to prevent further complications. So the ethical dilemmas. Beneficence is the act of doing good or action to benefit others. In this case, the nurse could have been seen as violating beneficence because she is trying to persuade Lee to do the gene therapy trial that has not been approved by the FDA. This was not explained to Lee and the mother, seemingly from the case study, due to lack of evidence in that the treatment worked, yet they were still willing to do the therapy. This could also lead to poor side effects due to lack of research on greater number of people. The FDA is used to ensure that the researchers find out new ways of treating people in a safe and effective way. The nurse is violating beneficence by telling Lee and the mother about it, knowing a poor outcome could come of it. It is also the nurse's duty to warn, including the children that could have the mutation. The mother may not want to get genetic testing, and they may not want to have their children do it either, which would be violating beneficence on the mother's part. As for non-maleficence, is to do no harm intentionally. The nurse went behind the doctor's back and told Lee and the mother about the gene therapy, even though it is not in her scope of practice to recommend treatment plans without talking to the doctor prior. This could cause harm to the patient because the nurse is unaware how the gene therapy will react with the patient, especially because she's a new grad nurse, whereas the doctor has been doing research with the cancer for years. The nurse does not know the side effects this gene therapy could cause for Lee, as the study has been stalled. So, with lack of research and proof of benefits, the clinical trial could potentially harm Lee. As for autonomy, it means the patient is able to make independent decisions. As a nurse, it is our responsibility to ensure the patient has all needed information to make a decision and is educated through it all. Lee's autonomy was taken when the nurse did not give the full extent of the gene therapy, excluding the fact that the FDA had not approved this TP53 clinical trial. Due to lack of information involving the cell, the patient was unable to make a proper decision. Justice means being impartial and fair. The nurse in this scenario became emotionally invested, thus giving this family better treatment compared to other patients. Due to her constant research and trying to figure out treatments for Lee, she put in much more effort than she would have for others due to her becoming emotionally attached to the family. However, the emotional attachment could be unfair to Lee and his family because she is not professionally making decisions now, but rather deciding based on her emotions. Adrenocortical carcinoma is a rare malignant cancer that forms in the outer layer of the adrenal gland. Symptoms often include a lump and or pain in the abdomen. The TP53 gene helps to stop the growth of tumors, and as seen with Lee, he has a mutated TP53 gene, so the gene is unable to control the growth of the cells, thus leading to cancer. The TP53 gene is often inherited from parents. The treatment options for adrenocortical carcinoma depends on the stage and size of the cancer. Prognosis is better if it has not spread to other places and depends on the patient's general health. For Lee, he's a young 22-year-old who should have relatively good health. There was no mention of the disease spreading to other organs, which is promising for the prognosis. Standard treatment is surgery, radiation, therapy, chemotherapy. There's also the possibility for clinical trials for treatment choice. If the cancer has metastasized, there is usually a 5-year survival rate. Treatment options for stage 1 is typically surgery of the tumor, whereas stage 5 tends to be chemotherapy with mitotane. For gene therapy, there are risks associated with it, so such as immune system reactions, targeting the wrong cells, infections, or causing another form of cancer. Clinical trial gene therapy could potentially save Lee's life, as the standard treatments do not always work. However, there are a lot of risks already associated with it, and not even including the FDA not approving the specific TP53 gene therapy trial. Autonomy is the freedom to have choice and for an individual to make their own decision. Lee is capable of making his own decision because he is sound and legally competent over the legal age. After discussing with the nurse, Lee and his mother decides he should get the gene therapy and hope it'll change his future for the better. However, what Lee is missing is the important facts such as the FDA not approving the gene therapy he's looking at. The benefits and risks have naturally been discussed with Lee because the nurse has only shown him the positives of the gene therapy and hopes Lee will want to do it. Lee has agreed to do the gene therapy, and even after discussing with Dr. Aiken, there was no talk of the FDA not approving this trial to Lee and his family. Lee has been violated of autonomy because he has not been given all the information to then make an informed decision on what to do with the treatment, which could be life-changing. Due to unavoidable trust, the patients have no choice but to have full trust in the nurse. Nurses are supposed to follow patient advocacy, and as a nurse, she should ensure the patient has all adequate information to make informed decisions. Adrenocortical carcinoma is a rare cancer occurring in only 1 to 2 per million people. Adrenocortical carcinoma is often treated with surgery to remove as much of the tumor as possible, and oftentimes ACC can be cured by surgery if the tumor is small enough and in an early stage. However, with larger ACC tumors, if the cancer has spread to other parts of the body and having a later stage of cancer, chemotherapy is also used. The early stages can often be cured if it is early on and tumor is small. Later stages often do not have high survival rates, with about 36 to 46% having a 5-year survival rate. According to research, surgery is the main active treatment for early stages, but reoccurrence is common with about 15% to 85%. For the nurse, this was not a high enough probability, thus she found gene therapy trials in hopes for a better outcome for Lee. Gene therapy is often inserted through a vector into the cell. If Lee ends up going through with the gene therapy, he has a greater risk for infection, another tumor forming, inflammation, or organ failure. Especially since the gene therapy is not FDA approved, there's a higher risk that the therapy is unsafe. However, if Lee does not get the gene therapy, he can get his TP53 gene. However, if Lee does get the gene therapy, he can get his TP53 gene replaced or add genes to solve the problem. This way, there will be less likely recurrence of the cancer coming back. This treatment could have less side effects if it works properly compared to standard treatments, it also could have repair the defective TP53 gene before they become cancerous. The ethical issues that arise are beneficence because if this gene therapy is given to Lee, what are the odds his quality of life will be better? There's not enough research to show that the specific gene therapy for the TP53 gene will benefit Lee in the long run. Who is to say he will not develop a worse type of cancer from implanting a new vector into his cells? Both of the choices have risks and benefits, as the gene therapy can help treat the patient better than the standard treatments, but can also cause for a far worse outcome if it goes wrong. With lack of research to back this type of gene therapy, the nurse is acting on emotion rather than knowledge, which in the end can hurt Lee and his family. There are biases that may impact Lee's quality of life. The nurse has become emotionally connected to Lee and his family, so she's acting on emotion in his case and is willing to do anything to have him and his family saved. She is not thinking soundly due to her will to do anything to help him, even though she could be missing how this could affect him in the end. With a lack of knowledge for Lee and his family due to poor communication, the patient was unable to practice autonomy fully and only made decisions by what the nurse was saying, who only promoted the gene therapy. There also could be a bias of Dr. Aiken because she also works with this type of cancer and wants to be able to promote her career more by using new forms of medicine to help young sick patients. It is unsure if the doctor wanted to help solely for the patient or because she does research and is on the cutting edge treatments for this disease and wants to have more research for her own sake. She also never mentioned the FDA not approving the gene therapy, yet still allowing the patient to go through with it. As stated before, this is a rare disease with only 1 per million having adrenocortical carcinoma. There are very few who have later stage of the cancer that make it past the 5-year mark, and even those with early stages tend to have reoccurrences. Dr. Aiken might have more inclination to take it upon herself to promote gene therapy since she's conducting research on ACC. The mother also has interest in clinical decisions for the son. She does not have a say since Lee is 22 years old, but the mother is facing the same struggle with cancer similar to her son, and it would be helpful to know if she is a TP53 carrier to then help prevent cancer for other kids. There are conflicts of interest within the institution, as stated prior. The nurse is attached to the family. She has been using all her spare time outside the hospital and finding out more to help this family. Emotion is running high for the nurse as she has not set boundaries for herself, is now acting on emotion rather than knowledge. This all relates to justice because now this patient is getting better care than others in the hospital because of the favoriting care for Lee from the nurse. However, this also makes Lee an unfair advantage too because the nurse and doctor are acting almost in ways to benefit themselves rather than the patient. The nurse is selfishly wanting to keep Lee alive because she's emotionally attached to the family. The doctor is selfishly doing it for her medical practice and to make her practice look better with newer therapies. My original perspective was the nurse wants to help the family, so she is willing to research about treatments to then help them in the long run. She is being a great nurse by using her extra time to learn more about her patient's illness and to come up with treatments for Lee and his family. My alternate perspective was the nurse is acting in regards to her own emotion and is therefore withholding information from the patient. So for the ANA Code of Ethics, I picked provision 2 because it relates to the ethical issues in this case. First off, as seen in 2.1, it is up to the nurse to have honest discussions about all available resources and treatment options. However, we saw in this case study that the nurse only discusses the treatment option of gene therapy to Lee and his family. In 2.2, the nurse must examine the conflicts arising between their own personal and professional values. However, the nurse let her personal feelings get the better of her and let her professionalism be overtaken. She got emotionally invested in this family and has pushed her own treatment ideals on the family. In 2.3, it states that collaboration intrinsically requires mutual trust, recognition, respect, transparency, shared decision-making, and open communication among all who share concern and responsibility for health outcomes. So the nurse should have spoken to the doctor and other members of the healthcare team prior to telling the family of the treatment. It is not up to the nurse to solely make a decision on what treatment is best for the patient, but rather a collaboration with the healthcare team. In 2.4, it states that the intimate nature of nursing care and the involvement of nurses in important and highly stressful life events may contribute to boundary violations. The nurse portrays boundary violations in this case study because of the high stress and the care she has for this family. She goes behind the doctor's back and tells the family the treatments they should do, and the nurse does not give the full information to the patient. As a nurse, all decisions are made with the doctor and other healthcare professionals, and all of information must be given to the patient. So this was violated as well. After reading through this case study, it was hard to understand the fine line between helping and hurting a patient. It is easy for nurses, especially new graduate nurses, to get attached to patients. I found it hard to tell where she was ethically wrong at first because the nurse's goal was always to help Lee and the family. However, I learned that it is important to separate emotions from work. It is important to be empathetic towards your patients and truly care for them. But when a nurse becomes so invested and emotionally attached, it can lead to poor decision making. As we can see, the nurse did not give the whole truth many times throughout this case study. She originally did not want to tell Lee or his mom about the suspicion she had of the genetic mutation in fear of upsetting them. Then she did not tell the family about the FDA not approving the gene therapy she was promoting for Lee. The nurse's job is to allow full decision making to the patient, and here the nurse seemed to have made the decision and explained only this option to them and made it seem the best. Unavoidable trust is a term I learned from the textbook that shows patients trust whatever nurses say, but they do not know much about medical terms and treatments. So the nurse only giving the genetic therapy option deterred any other options for the family. Autonomy was definitely breached here, as seen from withholding information from the family. Okay, so let's apply it. An oncology nurse talked at length about her frustrations and moral distress in having trouble providing adequate pain relief to her patients. She said she only has half the painkillers she needs each shift, but knows that she will need to do what is morally and ethically right for her patients, despite her feelings. Here is an excerpt of her internal conflicts. Do I give them to the younger ones who might live longer, or the silent, suffering old ones who worked their lives for us? She asked. It just isn't fair. I know who sells hospital drugs, sells them, but if I complain about him and report his behavior, will I not have a job tomorrow? So I said, ethically, let the nurse manager, HR know about the coworker taking the medication so the nurse can properly care for the patients. And unethical, allow the coworker to continue to sell hospital medications, therefore have the appropriate medication for patients. The nurse knows the coworker is taking the medication, is selling them, and information like this affects the patient. As a nurse, the number one priority is the patient, so it is the nurse's responsibility to report this. The ethical route would be to follow the moral integrity, which include honesty, truthfulness, benevolence, wisdom, and moral courage. The unethical route would be to allow the coworker to continue to sell hospital medications, which then makes for less medications in the hospital for the patients. This is an example of moral distress. The nurse knows that the ethically correct action to take, but fears to take it. So the nurse would refuse to say anything in fear of losing her job, which is portraying moral distress because the nurse is not being honest or standing up for what is right because of fear of consequences. And then let's apply question 2. You are working the night shift on an oncology floor, and your 45-year-old patient suddenly goes into cardiac arrest and dies just hours after the doctor said she would recover well from her lung tumor resection. The organ procurement team arrived just as the family arrives, and you have had very little time to discuss options with the family. They state that their loved one was an organ donor and they are aware of the time constraints. However, the surgeon noted in the patient's medical chart that there was a possibility of cancer spreading to the nearby organ, and further diagnostic tests were needed. The surgeon has not had a chance to discuss the possibility of metastatic cancer yet with the family. So I said, ethical, page the surgeon to discuss with the family about the possibility of metastatic cancer in the patient and test to see if he does. Unethical, tell the patient's family that the patient could have cancer without discussing with the doctor or allowing the procurement team to just take the organs without making sure the cancer did not spread. It is not within the nurse's scope of practice to tell the family before talking to the doctor about the possible diagnosis of metastatic cancer. Thus, ethically, the nurse should page the doctor to discuss the further steps in regards to telling the family and testing the patient. The organs are viable for a few hours, so trying to get the surgeon to act quickly is the goal. The nurse cannot communicate a diagnosis unless it is delegated to them by the physician. The unethical approach would be to go behind the doctor's back and tell the patient's family anyways. The family will have questions, and the nurse at this point does not have any answers. With the lack of information, not following the scope of practice guidelines, the nurse is affecting both the patient's family and the healthcare team. Does anyone have anything to say about this one? Okay, if not, but just thought I would try.
It's just out of our scope, yeah.
Yeah. Okay.
I think that a nurse has to stay within their scope of practice, like Kevin said, and just stay within their boundaries. You have to let the doctor do their job and the nurse has to do her job.
I also think it's important for them to page the doctor, like you said, because if the cancer did spread to the other organs and nobody's there to tell them and they give that organ to someone else, like that is also bad.
I agree. Okay, so now we're on to the discussion questions. Okay, so as a nurse, what is your scope of practice for researching genetic conditions and presenting to a family and/or health professionals? Does anyone know?
Well, I think this is obvious, but you want to present something that is FDA approved. And you also should not be presenting something for the first time. I think that should be a doctor's job. I think it's appropriate to suggest something to talk for the patient to talk to the doctor about. But I don't think it's appropriate for the nurse to initially discuss it and get the patient motivated and happy and only, to set the patient up for failure at the end.
Yeah,
Yeah, but is FDA approval actually that important?
I know that's something to think about because some cancer medications are not FDA approved and a lot of people still use them, but I don't really
Well, I
know.
was just thinking of codeine, or not codeine, oxycodone. The opioid problems caused because of the FDA giving that blanket approval.
Actually know that. Interesting. Okay.
They gave a special label to the pharmaceutical company, so they were able to pawn it off to a bunch of physicians and trick them.
Interesting.
So a lot of rural physicians were prescribing oxycodone for like back pain. So then a lot of people got hooked on opioids.
And so do you think that's like similar to gene therapy? Do you think it doesn't matter same way for like drugs with gene therapy?
I would just take approval. So like if the backbone of the argument is that it didn't have FDA approval, then I would counter it with the argument I just made. But if it's like different where it's like I would emphasize the points more that it wasn't properly conveyed to them. Like, so like I've been watching like those doctor shows and like whenever they sit down with a patient, they're like, so these are your percentages. This is what has been shown to happen. The likelihood of survival is low. This is why it's experimental, stuff like that, giving them the whole rundown and getting an informed decision that way versus like, yeah, it's kind of important to mention the FDA part. It's definitely important actually, but I feel like there's a lot more than just that.
Well, I also feel like they just didn't, the nurse nor the doctor really gave any information from the case study, at least. It doesn't seem like they said much. They really just like said the positives about gene therapy, it seemed like. So they needed a more education in general, I feel like.
Have you guys seen like either a physician or nurse pushing one agenda or another? I've seen a lot of just pushing like the stopping treatment versus like people pushing treatment in my experience. I'm not sure if you guys have seen something else, but I don't think I've seen someone truly like unbiased in what treatment they believe is best.
Yeah, I agree. I have seen I have seen doctors, nurses push certain things that, agendas, like you said, for sure.
Yeah.
So,
I mean, in this case, she's doing that. She's pushing the gene therapy. But I think the issue is that she didn't give like all the information or other treatment options in this case.
Yeah, I agree. I think that like the nurse shouldn't have been the one to go in there and just say, hey, like I saw this study, like you should do it. Like I think like the nurse should have went up to the doctor like right from the get-go and said like, hey, I saw this, like talked about it some more, and then the doctor should have gone in there with all of the patient's options rather than just that option.
Right. And I feel like
yeah.
the patients also need some time to think about it as well. You shouldn't really be pushing it. But even like coming from my practicum right now, if there is something that you want to get tested for, they give you a printout of all the information that you need to know that includes statistics and pros versus cons, benefits. And I don't I don't really recognize that in this case study. I don't think the nurse gave that or even the doctor to begin with either.
Yeah, I didn't see that either. It looks like they did not give like any other treatment options, just this gene therapy one, and did not seem like they gave any information on it to begin with. Just that like just telling them that they basically should do it. But do you guys think this is like within her scope of practice, like to even be researching the genetic condition?
No, not at all. I mean,
No.
she just doesn't have the proper training to be able to speak to this. It's just out of her scope of practice.
I'm gonna throw in a different answer only because there is so much like today at my practicum, I noticed something where there was something that the parents didn't know, and it was never discussed by the doctor or simple, like it was a donor milk, and so they were pushing formula on the patient. And the nurse that I worked with, she was like, there's a thing called donor milk that you're able to purchase. So what I'm trying to say is sometimes like those people that you trust, those professionals, either doctor or I don't know, in my case, the lactation expert, they should be discussing all this information with you and discussing all your options with you. Sometimes it is the nurse who kind of can say, hey, like there's this new thing. I don't know if you guys have heard of it, but this is also just another option for you guys. It doesn't mean that the nurse should be biased about it or act out of emotion, but I think it's appropriate or within the scope of the practice just to say like, hey, like there's something I heard. If you're interested about it, maybe talk to the doctor, see if this will benefit you in any way. But I think that should be like the mark where you're crossing boundaries. That should be like the most that you can do or say.
I think that even with that, I think the nurse should, before making any new suggestions, I think that it's the nurse's responsibility to consult with the doctor first. With anything, that's how I feel. I feel like the doctor should be consulted with anything, even if it's like, little thing like donor milk or whatever. You don't know exactly what the doctor said to the patient before the patient said to the doctor, you just want to consult with the doctor first, I think.
Right. And I agree with that too. I feel like you do need to have communication and teamwork. And I feel like in this situation, that was definitely not apparent. So she didn't communicate with the doctor at all about the testing. So that was like something that she also was not participating in, like her scope of practice too, because you're supposed to, like perform teamwork.
So do you think it's okay that she was even researching it at all though? Just not even like talking to the patient. So before she even talked to the patient, she was doing all that research like on her own and stuff. Like, do you think that's within your scope of practice as a nurse?
Yeah, of course. You're allowed to research anything you want to research,
In case a patient asks you a question about, let's say, a medication or anything, you want to know, you don't want to sound like you're dumb, that you don't know your information. You want to know your information. It's just, pushing something is not okay. I think that's up to the doctor.
What if she pushed it in a different way? So what if this nurse is like really on top of their game on oncology and they're researching this stuff, and then this treatment slipped through the cracks of the physician, and she's like, hey, I know about this treatment that I've been looking into on my research. Is it okay if I bring in the physician? You guys can discuss more about it. But these are some of the outcomes. What if the conversation's tone was different?
That's probably more appropriate because you're sending in the physician to speak about the new procedure or new medication, opposed than you acting like a physician. You're out of your scope of practice at that point. So I think that would be the ideal, is telling the patient that you're going to bring in the physician.
Yeah, I don't know if that happened here just because this is like a new grad oncology nurse. Like I think she's recent, it said. So like I don't really know how much she would really know, even if she did do research, whereas the doctor's been like doing this for years and stuff. So I feel like she should have talked to the doctor either way before, just because she's new. The doctor is a specialty in this.
Yeah, also from the context of this like reading, I think it was like obvious that she was only conducting like that thorough research because she got that attachment to the patient.
Mm-hmm.
So I think just like in the context of this specific example, like it is out of her scope of practice to like present this like research that she was researching, but I obviously think it's okay, like if she is interested in something and wants to like further her education, then it's okay to like go home and research it, but like you can't present it in the way that she did.
Aren't we trained to do research though, as nurses? Isn't that like one of our courses?
Yeah, so I think she should have done, like, you're allowed to do research, it's within your scope of practice, and like for your own personal knowledge and stuff, and even bringing it to the healthcare provider would have worked, but like it was more so the fact that she went behind the doctor's back and talked to them about it before even like minorly discussing with the doctor at all. I think that was like out of scope of out of her scope of practice, because like as a nurse you are not like supposed to it's not like within your scope of practice to like call treatments by yourself without like talking to the doctor, like a collaborative like effort at all.
I think that as a nurse, it's very appropriate and within the scope of practice to be compassionate and care for a patient. But I think it starts kind of getting into a gray zone where you start obsessing or being biased about it and like kind of pushing things and just being obsessed with caring. And I think that's not part of the scope of practice, because you should be treating each patient equally.
You need to learn to set boundaries, I feel like. With that, like, let's go question 2. Did this nurse overstep any professional and or personal boundaries with this patient, family, or doctor? Kind of like talked about this, but
I mean, especially with the doctor, I feel like if I was a doctor, I wouldn't be comfortable with somebody being like, my patient coming up to me and then they're like, hey, like the nurse did this, we're excited, like we want to try it. I'd be like, hold up, what are you talking about? Like, we don't even know if we can even try this. And, it kind of puts you in an awkward phase or in a relationship with your team.
yeah, definitely. Yeah, it definitely makes things awkward.
Yeah, no, I think she got too attached to the patient and it kind of blurred her,
Professionalism.
yeah.
Yeah, so I would say she definitely overstepped professional boundaries, especially getting so attached to a patient. You need to learn to put boundaries up. Like you can't be like getting emotionally attached and then like coming up with all your own ideals and like treatment plans for a patient just because like you want them to like around still.
Can I change my answer?
Yeah.
I looked up our scope and it would be part of our interdependent functions. So if we recognize something, appropriate standardized procedures, and we can change in treatment regime in accordance with those standardized procedures after observing signs or symptoms that we deem necessary of the illness, reaction to treatment, general behavior, or general physical condition.
So you think it's like, so you're saying you think it is in the scope of practice for her to say something to the patient?
Yeah.
Well, that's definitely a good point to write down for a conversation.
Good point. Okay.
I feel like I'm a little bit back and forth because I think it's appropriate for a nurse to be like, hey, like, this is the research that's out there. You can take a look at it and you can ask questions to the doctor. It's okay to kind of like professionally push it that way, but you need to also respect like the doctor's boundaries as well and like their scope. So I feel like I'm like right in the middle of, is that within the scope or is it not? Because like Will said, nurses still have a lot of power. They still have a lot of independence to do their job. But the question is that are you also doing the doctor's job too?
Well, doesn't that where different titles of nursing come in?
Right.
Like a nurse practitioner, then that's when you can probably do that. Now, if you're like a newer grad nurse, probably not. You gotta like know where you draw the line as to like how professional you're gonna present this.
Yeah.
Yeah.
I mean, you got to think of it this way. There's a lot that we don't know. What if it's a new grad nurse who just recently graduated here, but maybe abroad they were a doctor and they had a lot of information? So there's just a lot that we also don't know.
I feel like this case study is missing a lot of information, to be honest. Like a lot more could be said about it all to help like answer these questions. I also just think with like it's just as tough to like be on the nurse's side totally because she didn't give the other treatment options. Like even if it is maybe in her scope of practice, like you still need to give all treatment options available. And like she didn't do that. She only gave the gene therapy as the option. So it's like maybe it's in her scope of practice to talk about it, like give like new treatments, but like you have to be able to give all treatment options and let the patient choose themselves.
Right.
I agree with that. I think like every option should have been given to this patient regardless. And I think like because she said like in the case study even says like despite trying to maintain professional level of emotional distance, like you have become attached as the nurse. So I think like maybe just like the fact that it says in this case study like she became so attached that she was staying up nights researching this and she got so excited about it and like that was the only one she wanted to present to this patient. Like I feel like conducting the research and everything is fine, like as nurses like you're able to conduct this research, like maybe present it, but I think every option should have been presented, like all the statistics should have been presented, like not just like, hey, there's this like gene, whatever, like we should do this without any other information.
It's a good point.
Okay, we can go to question 3. How does a person's coping mechanisms and or personality play into an ethical dilemma?
I think I kind of touched upon this when I was saying like she was starting to get a little bit obsessive instead of, being the nurse that we're all compassionate, we're all caring, but there comes a point where you just shouldn't obsess over a patient. You gotta give them that autonomy to do, make those decisions.
Yeah, I said it was she had like a coping mechanism with more like emotion focused. She wanted to like to do anything to keep Lee alive and keep his family like happy and like then she grew attached and stuff. Whereas it should have been like more problem focused, I'd say, like thinking about the risk and benefits related to the gene therapy. Like is it actually beneficial for him or is it just like what you want and like think about like what's like allowed under her nursing license and like she wouldn't like cross the boundaries that she did then.
Mhm.
You can get tunnel vision from being obsessed with one thing. So your perspective's narrow.
Right. I wonder, like, when thinking about like a coping mechanism, what if Lee was somebody similar or similar to just somebody that she knew or lost in a similar situation, and that she maybe thought that this was the best way to, prevent somebody else from losing their loved one, or that could be like a coping mechanism maybe she was thinking about.
Someone in her life.
Yeah.
Yeah, that's very possible. I feel like that happens a lot. And yeah, like obviously the way you cope with things obviously affects like how you ethically deal with things. Because emotions can like when you get like attached or like emotions are high, like you do anything based on the emotions rather than like thinking logically, I feel like. And I feel like this is what happened with the nurse in this scenario.
Mm-hmm.
Yeah, I think that she was kind of like had the tunnel vision and she wasn't like at all thinking about the risk and benefits, like you said, Alex. Like when you're a nurse, like even if you do think like whatever you're focusing on is the right option for the patient, like you always have to consider like what if.
Okay. Does the nurse have any professional and or personal biases?
Probably emotional bias
Yeah.
or bias driven by emotion.
Yeah.
Yeah, she got too attached to this patient, too involved emotionally.
Yeah.
Yeah. I said it was like a personal bias to Lee and his family. Yeah, like we said, she got too attached, and that's why she only presented the gene therapy to Lee and did behind the doctor's back because I mentioned nothing else besides that one treatment because she wanted like him to do obviously the gene therapy.
I think as a nurse, like working as a nurse, you need to be cautious about how connected you get with the patient, especially if you work with pediatrics. Pediatrics, you can really connect with them, and you have to leave that behind sometimes. You can't bring work home type of deal. So I think as a nurse, you really have to be cautious as to how connected you get with your patients and how involved you get with your patients, because it can, in this case, make you research things outside of work, or, spend a lot of time doing something other than, type of deal.
Yeah, I definitely agree. Boundaries are like super important. I feel like you said, like you can't bring work home. Like the fact that she was researching like at all hours of the night and stuff, like she like crossed like too many boundaries for herself and then became attached. I also think it's hard for like new grad nurses to not become attached, especially I heard especially like peds and like oncology too. You get really attached to patients. So I think it takes a while before you really learn to detach from patients. So I think it's like a common thing for nurses, like new grad nurses, to experience this. But yeah, you just need to like be aware of it and like make sure like when you're done with work, like you are done with work.
I agree with that. You should never really take work home. And I know like from personal experience, because when I started working as a CNA, I had a patient that I was taking care of for like, I don't know, 4 months, and she was always mine. So I was always getting assigned for her every day for like 40 hours a week. And you kind of, with her, it was like, yay, like you're getting better and better. And then one day I go on my shift and it's like she's literally taking her last breath. And obviously you build a relationship with them and you get attached to them because you're always seeing them. Like I saw her more than I got to see my own family for those couple of months. And so you do get attached. But I feel like as a new grad nurse, I did learn from that, because I know I wouldn't make that same mistake that I did when I like with that patient now. So I feel like maybe that's excited like new grad personality or moment that she experiences, but I don't know, I guess she just hasn't learned those personal boundaries yet, maybe.
Like in psych, for example, a lot of like where I work, a lot of these patients don't have any support outside of the hospital. So it's like all they get very attached to the staff. And I think I've been asked so many times by so many different patients, can we keep in touch? Can we get each other's phone numbers? And as a new nurse, I kind of freeze when they ask me that, because I'm like, oh my God, this is so awkward. This is so awkward. But I have to say no, and then, I was like, it's hard. Like, how do I deal with it? I don't want to like hurt their feelings or anything, but a suggestion was that they can always call you at the hospital. That's what the nurse that I was following said. You can always tell them they can call you at the hospital, so that was, I don't know if that's even still the right thing, but
I mean, it makes sense. It is like hard because like it's like a fine line between like being empathetic and like caring for a patient, and then like not like getting attached and like all that, because like when you're caring for someone, obviously like it's hard to like defer. I feel like it becomes like a tough line, like when to cross it and stuff.
Yeah.
Okay, and then number 5 was Dr. Eichen within scope of practice, or did she outstep her boundaries at any point?
I mean, it depends on if like when you pointed out that like maybe the doctor was only pushing this specific solution was because she conducted research herself for ACC. Like if that is the case, like it doesn't really say in the case study, obviously, but like if that were to be the case, then I think that that is out of her scope of practice. And like we said like earlier, like all options should have been given. And if she was only specifically giving that one option because she conducts research herself, then yeah, I think that would be out of her scope of practice.
I'm just gonna add to you, like maybe the fact that that's what she feels more comfortable with, the treatment with wise. Some doctors, you know, for example, you know, some of them will give him morphine over fentanyl or fentanyl over morphine because they feel more comfortable giving us a certain medication. So in this case, it could have been that. We don't know.
Yeah, and maybe there's a bias too, because that's like her line of work. Maybe she's so into doing research. What if she just wants to see another research that is successful and not a failure, or could make a huge difference? And that would, I don't know, who knows, maybe cause her some piece of personal gains. So if she thinks like that, or if in reality that's exactly what it was, then that is outside of the scope of practice, because you're supposed to do good to the patient, not, you know, just be like, hey, like I have a great research, it's going to get published, it's going to make a huge difference for everybody, but I don't know if the risks are going to outweigh the benefits with this specific patient.
Yeah, I said like it's obviously within the doctor's scope of practice to like come up with like the appointments and like discussing the gene therapy and everything. But again, the doctor is supposed to like educate the patient and like come up with all the treatment options. And I didn't see anywhere in the case study that the doctor even mentioned any other options. I just saw the gene therapy again. So Dr. Aiken she was crossing boundaries on that point. I feel like only again pushing the gene therapy when she should be educating everything to the patient. And also depending if the nurse was within her scope of practice, but I feel like the doctor also should have like said something to the nurse, maybe being like, that is not your like position to be talking to the patients about treatment before talking to me. Like I feel like the doctor and no one seemed to say anything to the nurse, so maybe she's gonna end up doing it again next time. Like who's to say like it won't keep going if she doesn't get like told it was not the right thing to do. So I also feel like the doctor should have talked to the nurse in that sense.
Right. I feel like it's both the doctor's and the nurse's fault in terms of like communication, because you can tell there clearly wasn't any proper communication or teamwork going on over here. So it's like we can point fingers at who's not within like their scope of practice. Maybe they both just aren't.
Yeah, that's true.
Or maybe they both are. Like it's like there's
Yeah.
not much information in this case, really. I think like there's a lot of like things that I'm a little confused about, but
Gaps in this case study, I feel like.
This is a very technical, like you'd have to get some sort of law involved if you wanted to find out who breached.
Yeah, I
Mhm.
agree. When I was doing research, it was like a bunch of lawyer stuff, and I was like, I don't know what this is saying. I feel like it is much more technical than like we think.
Yeah, I agree. It's definitely a little bit more of a confusing case study, but it gets you thinking, which is good.
I did create. I'm not that I really need it. We were almost at time, but I'll ask you one. Like, did your guys' original perspective change from like the beginning to the end? Because like my perspective totally changed when I first read it. I was like, the nurse is totally not doing anything wrong. I was wondering if it changed for you guys at all.
For me personally, I feel like I knew from the start when I read the case study, I was like, all right, there's boundaries. She's kind of low-key crossing them.
Yeah.
But I see where you were thinking too. Like I see your perspective as well.
Yeah.
I think her delivery was just poor. I think like her like introducing the idea is fine and not unethical, but the way she pushed it was wrong.
I
Like,
agree. I agree with Will that I think the delivery, maybe she used the wrong words presenting this.
Yeah. Yeah, I
Yeah.
agree.
I think like it was said earlier, I'm gonna bring in the doctor to, I'm gonna present you something, but if you want more information, I'll bring in the doctor so they can, you can discuss about it. That could have been the better way of doing this, better delivery.
I also think that any research that she had, she could have easily done in the hospital too. Like, a lot of nurses stay a little bit after just to document, right? So what if you want to stay a little bit after just to do research? It doesn't mean that you have to take your work home. So like Kevin and Will said, they should have just not found a right way to address it.
Yeah, I just found it hard at the beginning because like she was doing everything from like a good perspective. So I was like, she's not really doing anything wrong, but like then you see like she is crossing too many boundaries after like reading about it all. Okay. Anything else anyone wants to say? I'm gonna do the 3 points. Can you guys see my screen?
We only see the PowerPoint.
Oh, damn. How do I? All right, we'll just talk it out. What are 3 points that you guys, 3 main points you guys think we had?
I think crossing the boundary, the professional boundary, becoming too emotionally involved with your patient on like a personal level, and kind of, yeah, just too emotionally involved and attached
Yeah,
to the patient.
Definitely.
I agree.
I think giving the patient all potential options, like in a discussion when they first walked into the room, like, yeah, they're allowed to suggest something, but I always think it's better to like put everything out on the table
Yeah,
and give them all the options that they have.
yeah, I agree. I also feel like maybe they, yeah, I was gonna say maybe something in relation to like scope of practice, because I feel like obviously the nurse didn't know much about scope of practice, and I feel like it's a lot, so we can do something in relation to that.
I feel like she kind of overstepped on the doctor's scope of practice, kind of. Maybe they switched roles, possibly.
So, yeah.
Mm-hmm. Yeah.
Okay. Sounds good to me. I got all 3. Okay. Let me stop. How do I-
If you're trying to unscreen, share your screen.
There we go.
You got it. I totally just said that so wrong.